A child will often know that they are transgender from the moment that they have any ability to express themselves. We have parents who tell us that their kids, they knew from the minute they were born practically, and actions like refusing to get a haircut or standing to urinate, trying to stand to urinate, refusing to stand to urinate, trying on siblings' clothing, playing with the, quote, opposite gender toys.
So most of the patients that we have in the GEMS clinic actually know their gender, usually around the age of puberty, but a good portion of children do know as early as seemingly from the womb. So in the GEMS clinic, we see a variety of young children all the way down to ages 2 and 3. Parents do wonder if a child's gender identity is a phase. Sometimes it may be just a phase of development. It may be just a phase of development. It may be just a phase of development.
Puberty blockers are a group of medications or hormones that we use in the transgender population to stop puberty from progressing. And their job is to really interfere with the signaling from the brain.
And their job is to really interfere with the signaling from the brain. And their job is to really interfere with the signaling from the brain.
For top surgery, you are requested, but not required, to have been on gender-affirming hormones for at least a year. Many surgical centers require you to be 18. At Boston Children's Hospital, for top surgeries, we'll see people as young as age 15.
Chest reconstruction is a procedure that we perform to patients who identify as non-binary or transmasculine, or are interested in having their breast removed. Important for the patient to remember that this is an irreversible procedure. The patient will not be able to breastfeed in the future, and to the majority of the patients, they are going to lose completely the sensation in the nipples. Most of the times, their nerves do not grow in, and therefore, they will be completely numb.
A gender-affirming hysterectomy is very similar to most hysterectomies. The removal of the uterus, the cervix, which is the opening of the uterus, and the fallopian tubes, which are attached to the sides of the uterus. Some gender-affirming hysterectomies will also include the removal of the ovary.
Phalloplasty is a procedure to basically create a penis or a phallus for an individual who was born biological female. The urologists manipulate the tissues in the surrounding area to lengthen the urethra. A new scrotum is created, and some of the anatomical parts of the female anatomy are removed. We typically utilize tissue from elsewhere. For example, the forearm or the thigh is used.